Welcome to Pediatime, time to learn pediatrics. In this video, we're covering Goldenhar Syndrome, a congenital condition every pediatrician should know. Hit subscribe and let's begin. Epidemiology and pathophysiology. Goldenhar syndrome, or Oculo-Auriculo-Vertebral Spectrum, affects 1 in 3,500 to 5,600 live births, with a male-to-female ratio of 3 to 2. The pathology involves abnormal development of the first and second branchial arches during weeks 4 to 8 of gestation. Most cases are sporadic, but 1 to 2% are familial. Clinical triad. The classic triad consists of 3 features. First, hemifacial microsomia with mandibular and maxillary hypoplasia. Second, ear anomalies, including pre-auricular tags, pits, microtia, or anotia. Third, epibulbar dermoids or lipodermoids on the conjunctiva or cornea. Key point: 65 to 90% show asymmetric facial involvement, predominantly right-sided. 70% are unilateral, 30% bilateral. Vertebral and cardiac. Vertebral anomalies occur in 40 to 60%, hemivertebrae, fused vertebrae, and scoliosis. Cardiac defects affect 5 to 58% of patients, including ventricular septal defects, tetralogy of Fallot, and coarctation of the aorta. Renal, CNS, and hearing. Renal anomalies in 30%, renal agenesis, ectopic kidneys, hydronephrosis. CNS involvement in 10 to 15%, intellectual disability, hydrocephalus, microcephaly. Critical: 50% have conductive hearing loss from middle ear anomalies. Early auditory brainstem response testing is mandatory. Obstructive sleep apnea is common due to mandibular hypoplasia. Diagnostic workup. Diagnosis is clinical based on phenotype. Essential investigations include CT or MRI for craniofacial and vertebral assessment, echocardiography for cardiac defects, renal ultrasound for kidney anomalies, complete audiometry with ABR testing, ophthalmology evaluation for dermoids and visual assessment, sleep studies for OSA screening, chromosomal microarray if atypical features are present. Surgical management. Management is multidisciplinary. Surgical interventions: mandibular distraction osteogenesis for jaw hypoplasia, auricular reconstruction between ages 6 and 10 years, tracheostomy for severe airway compromise from micrognathia. Non-surgical management. Hearing aids for conductive hearing loss prevent speech delays. Speech therapy addresses articulation issues from facial asymmetry. Orthodontic treatment corrects malocclusion. Psychological support for body image and social integration is essential. Prognosis. Prognosis depends on severity. Mild craniofacial features without cardiac or CNS involvement, normal lifespan with good quality of life post-surgery. Significant cardiac defects or neurological involvement, greater morbidity requiring lifelong specialized care. Early recognition and coordinated care optimize outcomes. That's Goldenhar Syndrome. Subscribe to Pediatime, like this video, and drop your questions in the comments. Time to learn pediatrics.